Hi, this is Visit 1 and you're being assessed for Unit 3 of your Stage 1 competency. Now, straight ahead, I want to start. You ready? Okay? Good. So, this has to do with methods of ocular examination and definitely later on use of drugs for such. So, I want to know from you, I want to find out from you if timolol is a beta 2 blocker. Why do you think it is contraindicated in asthma? Okay, sir, to start with, I do not believe that timolol is a beta 2 blocker. Timolol is a beta 1 blocker, and it is not contraindicated in asthma. Drugs like betazolol are the ones that are contraindicated in asthma because they are beta 2 blockers. So, no, to start with. Alright, so between lidocaine and proximethicane, which do you think will be longer acting as topical anesthetics that you would want to use for Goldman applanation tonometry? What would guide your choice of these two different topical anesthetic? The difference between lidocaine and proximethicane is because with lidocaine there is stingy sensation after instillation, while with proximethicane there would not be stingy sensation, and it is more recommended for use in children because it will less stimulate reflex tearing. Mr. Chimizi, do you know that anesthetics are classed into two, amide and esters, and that the amide anesthetics are broken down in the liver while the esters are broken down right in the blood or in the eye where they are instilled, and that is why the amide anesthetics will have longer lasting effects than the esters anesthetic. Yeah, you're right that the amides will be longer acting. Promethicane, yep, will be longer acting, but in terms of the pharmacodynamics, they are broken down in the liver, the amides, while the esters are broken down in the blood. This is what you ought to know, and this is what you are expected to know. Alright, so the last question I would want to be asking you for this unit is, can you please tell me if your patient has an unaided visual acuity of 6.6 and you would want to perform a cover test at distance without correction, unaided as well, what would be your target? Are you with me? Do you need me to repeat myself? I said if your patient has an unaided visual acuity of 6.6 and you need to perform a cover test at distance, unaided cover test, what would be your target? What would be your distant target? Yeah. Okay, so to perform cover tests at distance, all I need to do is just to ask the patient to look at far, and then I'll cover the right eye and uncover it. Then
God
while I
have
cover the
mercy
right
upon us.
eye, I focus on the left eye, and then when I'm done with the left eye, I now cover the right eye while the patient is looking at far. Mr. Chimizi, do you mean to tell us that you're not aware to do a cover test at distance, you need to isolate one letter above the line seen by the worst seen eye, and then if the vision in the worst seen eye is less than 618, you are meant to use a spot target at distance